course, we know that migraine in women is a little different than it is in men. And so what I'd like to know is, how do hormonal changes throughout the female lifespan contribute to migraine symptoms? So from the time a young woman hits puberty to even going into perimenopause or menopause.
So migraine is, certainly affects men and women, but it's 3 times more common in women than men. And why is that? We know that there are significant hormonal contributions to this. Estrogen seems to be sort of the biggest factor here. However, there's certainly a lot of interplay between estrogen, other types of hormones, and also, certain receptors and chemicals in the body that have to do with migraine pathophysiology. So, estrogen interacts with serotonin and dopamine and all of these things. It also influences endovascular endothelium, so vascular endothelium, the way that the body, responds and maybe produces platelets, for example, or the way that platelets aggregate. And so all of these things combine to, somehow this being the way that it's manifested in women. And when we see these hormonal fluctuations during life, that's when we see migraine really surface and cause issues for women. So a lot of women, they have their migraine become a problem and sort of turn on at the start of menarche, so once they start their menstrual cycle. And that's really when we start to see this separation. So in kids, migraine is the same prevalence between boys and girls. And then once women hit puberty and girls hit puberty, that's when you see the numbers start to increase. And we also see, difficult times of migraine attacks and issues with migraine around these hormonal fluctuations. So menstrual cycle, pregnancy, lactation, when you see these ups and downs, perimenopausal periods can be really challenging for women because there is really a lot of fluctuation in these estrogen levels.
What vascular factors pose a concern for women with migraine?
We're learning more and more about migraine being a risk factor in cardiovascular disease. In fact, some European cardiovascular risk algorithms are including migraine in that because there's a higher risk for cardiovascular disease, developing hypertension or higher rates of hypertension, stroke, especially in migraine with aura, so patients who have migraine with aura. In terms of how this affects women specifically, I think we want to be looking at other risk factors that might be at play here. We know that women's cardiovascular risk factors can go up after menopause. And then we also know if you lay migraine or migraine with aura, especially on top of that, then you might be looking at an increased risk for developing, stroke or other cardiovascular conditions like hypertension. And then we also know that migraine, so people who have migraine, there are also seem to be higher rates of hypertension in general, obesity, other factors that are somehow contributing, that can contribute to cardiovascular disease. So what's really important is, number one, to know that this is a risk factor. Is there anything that we're doing about this right now? Not really, unless, of course, if someone has hypertension, we want to treat that. If someone has hyperlipidemia, we want to treat that. I think it's more to be aware that this is putting this woman at higher risk, and what can we do to mitigate those modifiable risk factors? Is that, making sure we get her blood pressure under control, that she is at a healthy weight, because we know that this population has higher levels of obesity, making sure she's not smoking, and having conversations about that and her individual risk factor.
So multiple conditions can cause symptoms similar to migraine, we know, such as gestational hypertension, preeclampsia, eclampsia, and several other conditions. So I would imagine that can make it a little difficult for clinicians to recognize a red flag during pregnancy in patients with migraine. So how does a clinician go about making sure that they're able to recognize those red flags? How would they even know with those other conditions that can kind of cause a little confusion?
So sometimes it's hard to tell and to know. The big red flag would be something new, something different, or of course, if there's any new associated symptoms, of course, if there is a focal neurologic sort of deficit or some abnormal neurologic exam. But we really want to be vigilant with women in pregnancy who have a history of migraine, or if they have a new onset of a migraine-like headache or aura. We don't want to just chalk it up to migraine, and we want to be asking careful questions to them about what things are looking like, and any new signs or symptoms that we need to be maybe investigating further. Have her come in for an exam, check that blood pressure, absolutely, measure the protein in the urine, because we know that preeclampsia is certainly something that occurs with higher frequency in terms of secondary headaches in this patient population. And doing imaging if needed, and not hesitating to doing imaging that typically is very safe if we're doing an MRI of the brain without gadolinium. That is something that we don't want to hesitate on for a woman in pregnancy.
Which migraine medications should be avoided in pregnant patients? I recently did a CME activity, and we did address treating migraine in pregnant patients, but we did notice that a lot of clinicians in pre-test had no clue regarding which migraine therapy should not be prescribed to pregnant patients. So what medication should doctors be avoiding in that population?
So, there's a long list of things to avoid, and certainly there's a list of things that are completely contraindicated. Some of the things that we think about, maybe you're weighing the risk benefits, but in terms of things that we are totally avoiding, anti-epileptics such as valproate or topiramate, those are contraindicated. Ergots, any ergot classes are contraindicated. ARB classes of hypertensives, those are contraindicated. And these are medications that we commonly see in use for migraine. So we always want to be reviewing our medication list and checking into things and making sure that there's nothing there that might cause harm to a growing fetus or cause problems in pregnancy. Also, what kind of supplements is this person taking? Feverfew is one that's contraindicated. So we want to talk about that and make sure we have a full list of over-the-counter treatments, also, supplements and prescribed medications, so we can review that thoroughly and make sure we're not missing anything that might cause harm.